Thursdays, again, we always have folks come in from the medical community. So today we're going to talk about your heart and heart disease. Leading cause of death in our country. Kills about 1 in 4 every year. February, American Heart Month, and since we're coming up Valentine's Day, why not? So joining us in studio, Dr. Frederick Mein. If you know him, you want to call him Trip. He's going to come in and talk to us about all things heart. Thank you again for coming in. You and I were just chatting. I brought up Ashley Garner. You know his story. We talked about it a little bit in the show. Seemingly healthy. Was just coming home from the gym. Goes to take a shower. Next thing you know, he's on the floor. How common is that story in what you do?
So really, unfortunately, Bob, we're seeing that more and more commonly, and that really gets to one of the things that we want to really stress to people, stress to patients and people who aren't yet patients is it's never too early to start really thinking about your heart health. We tend to think of it historically as a disease of old people, but it tends to be something that occurs much younger. And the real key, I think, is knowing your risk factors and making sure you take care of those and address them early before it's too late.
As far as screenings go and prevention, I would think that heart is like anything else. You don't react until you think there's a problem. What is the preventative measure that we can do? You know, especially somebody, I'll be 50 at the end of this year. There's got to be the prevention before I feel, man, that doesn't feel right.
Yeah, the last thing you want to do is meet me in an emergency room, right? So what you'd really like to do is be talking with your doctors, either your cardiologist or your primary care doctors, earlier than that about how you address the risk factors you were born with and the risk factors you've adopted over time. And so that includes all the little things that you already know, not smoking, making sure you are exercising regularly, and then also knowing your other risk factors, what your blood pressure is, what your cholesterol is. The U.S. Preventive Task Force actually recommends that for males with no risk factors that they get their cholesterol checked starting at 35. Okay. If you have any risk factors, as early as 20, which I'm embarrassed to say none of us were probably doing. Yeah. Women are it's a little vaguer because their heart disease tends to come later, but again, it's important for even women to know what their risk factors and their cholesterol are at an early age, and then if necessary, treating those either through diet, through exercise, or if necessary with medications.
In this age of information being everywhere, I mean, I can pick this up right now, go to Google, find whatever I want. I don't ever want you to be out of business, but are you finding people are more educated and there is a decline in maybe heart disease and maybe people are heeding the warnings before, again, they meet you in the emergencies?
Yeah, you know, I told somebody the other day when I started doing this, and it's now been, I'm embarrassed to say, 15 or 18 years, 3/4 of the patients I saw in clinic every day smoked, and now it's 1 or 2 patients a day who smoked. And that's clearly from people like you and TV and the internet, as you said, where people are really learning how bad this is for them and what it can do to them. And I think it's just as important we do that about all the other risk factors, right? The one that, if I had one thing that I would tell people to do every day on top of these things we already talked about, it's get out and exercise every day, right? And it doesn't matter what that exercise is. It can be walking, it can be running.
Yeah, walk the dog.
Walk the dog. More and more people we're seeing doing sort of out of the ordinary exercise. They're swimming, they're doing water aerobics. Pickleball is one of these things that's really big in the town. Even I've got a group of patients that does a team dodgeball 3 times a week. Whatever it takes to get out and active every day away from the computer, because it's so easy, as you say, in the age of internet to just get on the computer and do things.
Yeah, and we always say, again, if you have questions, if you think you're in trouble, don't call me. You always call 911 first, call the doctor. I would wear a gray one because they won't give me a white one because I don't know what I'm talking about. Trip, I appreciate it.
It's great seeing you again, Bob. Thanks.